affected by the heat, the summer heat, humidity, hot weather?
Well, seniors are very sensitive to hot weather and anything that will increase their chances for dehydration. And they are reacting a little bit different than younger adults in terms of low blood pressure, dizziness, confusion. So it's always important for the elderly to be very well monitored when it's coming to exposure to heat and dehydration.
What are some of the warning signs that a senior might be having problems?
Right, so it's always important to know the baseline of that particular senior, especially for dealing with somebody with some cognitive problems like dementia, because they usually, if they have that particular problem, they will not always ask for water if they become thirsty. So it's always important to know their baseline and assess them for any signs of increased confusion, lethargy, also physical signs like decreased skin turgor, which is the skin elasticity, which usually with elderly is decreased than a younger person, but it still can be assessed. And usually the best place for an older person to assess a skin turgor is within the interior side of the thigh. Because otherwise you can have false positive findings, like you think somebody's dehydrated when they're usually not. Also, blood pressure is important, and the most important thing for elderly in dehydration is acute weight loss. So if you have somebody that has a rapid decrease on the weight, chances are it is related to dehydration.
Can a senior's medications adversely affect them during the summer?
Absolutely, and that's a great question, because we want our seniors to go out in the sun at summertime. But some of them take certain drugs that could really make them very susceptible to sunburns and sometimes even phototoxicity. And some of those drugs are commonly used, like antibiotics like tetracycline or doxycycline, which is a very common antibiotic, but also diuretics like thiazides like hydrochlorothiazide, sulfa drugs. So a lot of drugs could make not only the seniors, anybody could have severe reactions from the sun exposure. So it's always important to use sunscreen protection, at least number 30. Also make sure they are well hydrated before and after, and sometimes you have to have a regular program for them for hydration, because as I said, if you have cognition problems like dementia, it's going to be sometimes hard for them to communicate and ask for fluids. Also, the time of the exposure to sun, it's important. You want to avoid the midday exposure, which is usually between 10 a.m. and 4 p.m. So if you do it early in the morning or later in the afternoon or evening hours to decrease the chances for sunburn.
And you probably should check with your doctor. You know, if you are a senior, check with them about medications, or if you're the child of a senior, check and see, you know, how could these drugs affect my parent? Absolutely, and again, not only the drugs, and I said I gave some example of very commonly used drugs as diuretics like hydrochlorothiazide, which is one of the most common drugs used for blood pressure, but also there are certain medical conditions that make the seniors, and not only seniors, any adult, very sensitive to sun exposure, like systemic lupus. Also dermatomyositis. So all of those collagen diseases could get a very serious reaction to the sun exposure. So it's always good to check with the primary care physicians about certain medical conditions, but also, as you mentioned, the certain drugs that could make the sun exposure a major problem. Could you make any recommendations to seniors? You know, how do they best cool off? If they don't have air conditioning in their home? Are there any suggestions that you could make? The key is hydration. And again, the huge difference will be somebody that's cognitively intact versus somebody is not cognitively intact. So if you have somebody with dementia, you really have to be very proactive and offer them hydration very often. Almost have like a schedule. We have here the hydration rounds, and make those fluids very attractive, not just water. And make sure the temperature of the water is reasonable, not too warm or too cold. We use some oranges or lime into the water to make it more appealing. So definitely a good scheduled program for those residents.
Also, when it's coming to air conditioning, if the place does not have air conditioning, you want at least to have some kind of fans, and also hydration. Again, it's a key to maintain their
And they probably
health.
should stay away from caffeine and alcohol, right?
Caffeine, alcohol, any beverages that will increase the chances for increased urinary output, but also keep in mind some of the elderly, they take diuretics, so that's also something very important to keep in mind. They tend to lose fluids quicker than younger adults, so it's always very important to monitor them. And as I said earlier, an acute change in the weight, an acute weight loss, it's the most reliable sign for dehydration in elderly, because elderly lose weight much quicker than other adults.
We have here a special geriatric clinic. You are a registered gerontologist, so you understand the aging process.
Mm-hmm.
Drugs can combine and create bad effects, or the summer sun. So talk a little bit about that geriatric clinic. What does it do? How's it set up?
Right. We have here at the Masonic Care community a free geriatric screening, which we mainly look at the geriatric syndromes, which are related to dementia, depression, anxiety, falls, incontinence, pain, decreased appetite. So we focus on those areas which usually are not very well covered on a routine primary care visit. So we do that for free, and we also look at the polypharmacy, which is a combination of drugs that could interact with each other, but also the number of drugs. It's a very important aspect. More drugs people take, higher the chances for side effects and higher the chances for falls. So we always review the medication they take and try to advise them and advise their primary care providers to cut back as much as possible on the drugs they take. And sometimes we recommend to discontinue certain drugs because of the significant side effects, especially with elderly.
And the drug interactions of different drugs, and how different drugs might work differently together than they work separately.
Absolutely. And again, the pharmacology works differently in the elderly, and the way the medical school is, the way the training in primary care is, we don't always focus enough on the differences between younger adults and elderly. So that's one of the focus we do here at the Geriatric Assessment Clinic, and we counsel our residents and we make recommendations for the primary care providers.